Hello, I'm Dr. Shah. I'm a board-certified periodontist and implant surgeon here at DentArt Chicago. We get a lot of questions about bone grafting, so today I'm here to answer some of the questions and to give you a better understanding on the topic. Let's go. A dental bone graft is a surgical procedure that involves adding bone grafting material to areas of your jawbone that have been thinned in order to increase the volume and density of your bone. It helps create a solid foundation for placement of implants or other restorative procedures. Dental bone graft is done in situations where people have missing bone caused either due to trauma, injuries, birth defects, periodontal disease, in order to create a foundation to receive a dental implant or other restorative procedures, and also to preserve the ridge in order to prevent bone loss caused due to the natural healing process post-tooth extraction. Absolutely, yes. So when a tooth is extracted, the jawbone loses the stimulation it previously received from the root, thus leading to bone resorption and alveolar shrinkage of the bone. Studies have shown that if no bone grafting is done, there is a significant amount of bone loss that occurs in the alveolar bone width in the first year post-tooth extraction. Hence, I highly recommend a bone graft post-extraction, whether or not you decide to get an implant. Like any surgical procedure, there's always be some risks associated with a surgery. With dental bone graft, if done correctly, the success rate is usually very high. However, in very few cases, the bone graft can get infected and can fail, especially if a patient has other medical issues or untreated medical diseases, or if there is any postoperative infection that can occur in case of poor hygiene or poor technique. However, we do provide all our patients with antibiotics, painkillers, and mouthwash to help the healing process be much smoother. So the bone graft surgical procedure is usually done under local anesthesia. So the patient will be awake and aware at all times. However, it will be painless as the patient is locally numbed in the area of the surgery. A small incision is made in the site where the bone graft needs to be received and a flap is elevated. We clean out the area and add the bone graft material into the socket. A resorbable barrier or a non-resorbable barrier called a membrane is sometimes used over the area to help protect the bone graft particles to stay in place, and then stitches are given on the top. The procedure is usually painless and most people recover very well after the surgery within 2 weeks. So there are 4 different kinds of bone graft materials available. Either you can take autogenous bone, which is bone taken from the patient's own body, or you can take allografts, which is bone derived from human donor tissue, typically bone banks. You can also get xenografts, which is derived from animal donors like pigs and cows, or alloplasts, which are lab-derived substitutes for bone graft material. In our practice, the most commonly used product we use is called an allograft. It works very well. We've seen great success with the product. It also reduces donor site morbidity, and I highly recommend using allografts. However, depending on the extent and amount of bone graft needed, it's important for you to come in for a consultation so that we can evaluate the site and choose the material that's best suited for your body. So the initial healing process can take about 2 weeks for a patient to start feeling comfortable. During this time, moderate pain, swelling, and discomfort can be expected in the area. We do provide patients with antibiotics, mouthwash, and painkillers in order to help the healing process be much smoother. However, in the long run, the bone takes over 3 to 6 months, even up to a year in some cases, to get completely resorbed and replaced by natural alveolar bone. I hope we've been able to answer some of your questions on bone grafting. If you have any more concerns or doubts or would like to get evaluated, feel free to call us on 312-929-4783. We're here to help, and I look forward to seeing you in person soon. Bye.